Welcome back. Well, tonight only on 6, what it's like inside 2 South Florida hospitals battling the coronavirus. We take you inside with exclusive video diaries captured by the healthcare workers on the front lines. NBC6 investigator Phil Prazen shows you how they put their own life at risk.
I never thought there would be ever in my nursing career a time
Never
when...
in Luke Vidrine's time as a critical care nurse have the days been so long. He begins his shift at Memorial West at 6:45 in the morning. These days, he leaves at 8 p.m.
Nurses don't need much to stay awake, especially during the day shift. Our patients are pretty critical, so we have to be on our toes.
He says COVID-positive patients are now in 6 units. Luke spends the time monitoring and trying to wean patients off the oxygen, a delicate balance for patients close to going over. Nearly the whole time, he wears a mask, his gloves, and a protective gown.
In whatever way, shape, or form, they leave these lines.
The job right now tears down not just the body, but also the heart.
Make sure I have my prayers until my time comes. I'm protected, and just the hope that this will be gone.
But he worries about bringing the virus to his family.
And then as soon as I get home, I tell my wife to get away from me. She may be quick to try to kiss me and hug me. And when I say, hey, stay away, and I go straight to the washing machine and throw my clothes right in there.
Walking into work, let's see what it has in store for me today.
Maria Suleiman, a nurse from Jackson Health's Rapid Response Unit, has already lived that experience. She tested positive in June. So did her 2 children. All 3 have recovered, and we spoke to her first week back at work.
About to go to a COVID unit.
And these hectic 13 hours can take a toll.
I've been pretty much short of breath all day. Very, 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 very sad. I know exactly how it feels because when I took my daughter to the hospital, I thought it was the last time I was going to see her. I didn't know because when you actually get into the intensive care unit, you don't know if you're ever going to see your family again.
1/10 of the bag.
I don't think I've ever heard so many code blues in a hospital. It's like every day, constantly, someone's dying on one of the units from COVID-19 complications.
They both tell us management and their co-workers hold them up. If they feel abandoned, it's by the many people outside the hospital, disregarding mask orders and social distancing rules.
I'm just urging the public to try and understand that this isn't fake. This is really serious.
I'm in a hospital. I'm a real person. These people are real people in the hospital, and they are definitely sick and dying before us.
So what have these 2 nurses learned from battling COVID? That life is short and disease does not care who you are. And they do have the message we've heard so many times before, to please socially distance and wear a mask. In Miami, Phil Prazen, NBC6 News.